All right, moving right along here, we're going to deal with I/O starts now, something that Johnny and Roy didn't really have an option for, but we do these days. So we're halfway through this first unit, and we're going to talk about I/O starts. And this lesson's really quick in terms of what we're going to present in this format. When you get into the classroom, we really want you to start finding landmarks, and there's going to be a lot of feeling of each other's legs and arms, and we may take a field trip around the office, or we may go to Walmart or lunch or somewhere and just find landmarks on people, because the landmark is the real key. But there's really two types of intraosseous or I/O devices out there. There's the old manual kind that we used for many, many years that were pretty much restricted to pediatric patients. And that is shown in that top picture there. The needle on the left is called a Jamshidi. That's what everybody calls it. It was the brand name, Jamshidi. And then the one on the right is a version of a Cook. There are several different kinds out there. We have some in a show and tell box so you can see them, and we have them for you to practice on. And this is still an option for you if you don't have the power-assisted types. This is still an option for you, and it's still part of the National Registry Psychomotor Skills exam, and so you still want to be able to do this. But basically, you take the needle and you find the same landmark, and instead of having a drill or some spring-loaded device, you just twist it back and forth with your hand until you feel the needle pop through the bone into the bone marrow, and then you're good. So we'll play with those. They have an internal trocar. In other words, it's not a hollow needle like you would find on on an IV needle, because otherwise you would get bone up in there. As you're drilling, there would be bone that would be stuck in the needle. So there's a solid trocar inside the needle, and then the needle becomes hollow once you take that trocar out. So this probably doesn't make any sense to you sitting here, but once you get your hands on it, it'll be a real quick and easy understanding. My guess is I could hand this to almost anybody, and having never touched it, and you guys will figure out how to use it. Then to the right of that, at the top, is a picture of the Fast 1 device that is used extensively in the military. This is a sternal placement. It's a spring-loaded, push it in, and those spikes go in the sternum, and it just gives me goosebumps just sitting here thinking about it. There's some very dramatic videos that are included in your Moodle course, and you want to look at those. We have one of those for you to look at and play with. Nobody uses them in a system that we work with, so we just have it as a show and tell, and we don't really teach it. Below that, with the blue cap on the end, is called the BIG, the bone injection gun, the BIG, bone injection gun. That's a spring-loaded device that drives the needle in. Those were used around here in the past, but not anymore. Everybody now is using that power-assisted easy I/O or the drill, and that's become kind of slang jargon around here. Is that and nobody says I/O, they say drill, and so those are really easy to use. Not much force is needed. Matter of fact, we'll practice on eggs, because that's the amount of force you need. Yes, it's a drill, but it's not like you're hanging pictures on the wall or something, driving anchors into drywall or something. You don't have to push hard at all. And the key step is to, with any of these, whether it's manual or the power assisted, the key step is to find the landmark, insert the needle to the bone, and then start drilling, whether it's manual or pulling the trigger. So we'll play with these a lot, and you'll get really good at this. The key thing, as I keep saying, is landmark, 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 the I/O sites. Now, there's two that we typically use: the tibial plateau, which is in the proximal tibial area. It is not in the knee. It is not in the midline. It is medial to that. There's a flat spot that you will find if you find your tibial tuberosity, which is the proximal end of that tibia. Very simple to find, pretty prominent even in obese people. And then you move medially, there's a flat spot there. And so we'll let you find that on each other and on me and other faculty members and unsuspecting people that work in our building. And it's really easy to find, and it's not in the way. Most of the activity in a cardiac arrest or critical patient is occurring up around the chest and the head, and this I/O site is way distal to that, and really is a pretty good choice, and it would be our first choice. The backup plan would be the humeral head. The drawback to using the tibial placement is you just can't give a lot of volume of fluid. And most of the time when we're drilling an IO, it's for medication, and so either of these sites will work just fine. But if you were to need to give a large volume of fluid, you just can't flow it through that tibial site well at all. But the humeral head, you can flow real volume through there. The landmarking is a little more difficult, potentially a little more intimidating, but it can be easily found. There's an excellent video posted on your Moodle of a cadaver lab, and they show the specifics on finding this landmark, and it's really quite simple once you get the plan. But again, we'll practice this over and over and over. Never fear. We'll do a lot of this in class. Insertion's easy. You find the landmark, you clean it and don't touch it again. Mark it just like you would with an IV. Insert that needle to the bone. You don't want to be drilling through the skin. You want to poke it till it hits the bone. Then drill with a little bit of pressure until you feel it pop in. Then remove your drill, remove that inner trocar, attach and secure everything. IOs are simple. It's the landmark that's the thing. After that, the technique is quite simple. There's 3 different sizes of needles for easy IO. The pink, the blue, and the yellow. The difference in them is their length, not their size. So 3 different lengths of needles. The pink one being for pediatrics, the yellow one being for most adults, and the blue one fits kind of in between. And so we'll go over and over and over that once you're in class.